Myself, my name's Gary Gibbon. I am a physician in pulmonology, allergy, and immunology, and I'm the first of a kind recipient of a multi-organ lung and liver transplant for the treatment of advanced lung cancer. So pre-transplant, I felt a lot of disappointment around the fact that there was no possible, conventional treatment for me, and I would have to, settle for hospice. So post a transplant, those thoughts and those attitudes were turned completely around, and I felt exuberant and excited to be part of a transplant program that was available to me as. So post-transplant, I felt like a new person. I had expressed how I saw the light at the end of the tunnel. Pre-transplant, I'd been despondent, disappointed by some of the lack of options for treating my cancer, and I was left with a decision regarding end-of-life care and hospice. And yet the DREAM program gave me, it excited me, it gave me a greater will to live, although I had a very strong will to live. And I was fortunate to have my wife as my partner and primary caregiver who gave up her life to support me through the transplant process. And so she was like a positive cheerleader in my life, as were my daughter and son and my sister and my family in South Africa, my brother and my sister. So I had great support from all over the world, and I felt that I could go on and I could fight through, the first 3 months after a major, abdominal and thoracic surgery, just because I had those pillars in place and I had a very optimistic view, and I was blessed with a positive attitude all along. And so I was mentally prepared and psychologically accepting of the donated organs and my rehabilitation and recovery from major surgery. Absolutely outstanding. The healthcare team at Northwestern has been brilliant, all the way from the DREAM program stands for double lung replacement and multidisciplinary care. And the multidisciplinary care is very important, and it's done like a well-oiled machine. The surgeons, the nurses, the physicians, the therapists, were respiratory therapists, physical therapists, speech therapists, are all fantastic. Not, I'm going to leave some people out, but all the way from anesthesiologists to pulmonary physicians and all the medical specialties that I required along the way, nephrology and hematology, oncology. It's been an absolute pleasure working with people that are so passionate and yet also so caring and compassionate. So they're passionate about their program, they committed to their program, they want it to be the best in the world, and you get the feeling that they're proud to be there and proud to be doing the job they're doing. And I felt that all along. And as a physician, I was in the unique position of being a patient and having to leave my doctor hat at the door and become a patient and have a patient healthcare provider or healthcare professional relationship. So 180 degrees different in a very positive way. My relationship with everybody, and I get on very well with nurses and ICU techs and radiology techs and all the people the ancillary people I came into contact with. I tend to get on very well. I've worked with them as, through the years as a physician. I've worked in hospitals, and so it's very natural for me to get on well, but it was exceptionally so at Northwestern. And I can't stress the importance it had in terms of my recovery, because whenever I would hit a wall or a tough patch or a rough patch, there always seemed to be someone there. My wife was there all the time, my daughter and my family and my sister and my son were there all the time, but not at exactly the times of crises. I mean, sometimes they weren't there and I was, entering a crisis period or a rough patch, and there was always someone to lift me up if they weren't there. My wife used to stay over at my bedside initially when I first came out of surgery, just to watch me and monitor me and keep me safe. And then when she moved away from that, close position, there were, a number of other people, particularly in the intensive care unit, that watched over me and made sure that I was doing well at all times. So it was an incredible achievement on their part, and it helped my recuperation and my recovery. It helped it greatly. Well, I think, in this day and age, we don't want to become too technology centered. We want to still remain patient-centered. So my advice would be, don't lose your, don't become robotic or machine-like, It's very easy when you have technology, and now AI will obviously be used in medicine more and more. But don't lose the human relationship with your patients. Don't, show your emotions, be compassionate, be empathetic, be sympathetic, be a person who they can trust. Patients love to trust their healthcare professionals. So the only way that happens is if you go out of your way to develop a relationship with the patient that gives them, a sense of trustworthiness, and that they will faithfully then, follow your direction and not the direction of a computer or a AI. Yeah, to fellow patients, I say this: if you're in need of a transplantation for lung cancer, any prospective patient should not give up. They should not quit when they hear, some bad news like I did. Get your doctors to refer you to Northwestern and to the Canning Thoracic Institute and the Comprehensive Transplant Care. And speak to Dr. Barat and speak to Dr. Nadig, and they will, determine whether you are a good candidate. So don't shy away from that and say, oh, well, I'm going to just give up and go on hospice care. There's no need to. Even if you're extremely sick or ill, you can still, as long as you can make it here, you're still viable and you're still a candidate. So, I mean, my sort of future goal is to advocate for prospective cancer patients to come to Northwestern and, partake of what I think is the best place to be in the world when, the chips are down and you don't have any other options available to you. So I'd like to end by advocating to organ donation, which is highly important, not just in lung cancer, but other diseases that are not curable without transplant. But certainly for cancer, I think I want to advocate as an organ procurement advisor. I'd like to also be a promoter for the DREAM program. I'd like the DREAM program to continue to be the best in the nation and sought after by other institutions in a way that they could be educated themselves and use the technology in their own institutions, so that it would become available to more prospective patients. But the organ donation is highly important, because in lungs you can't use living donors. It has to be cadaver. And so not only would I, highly recommend that anyone be an organ donor. It's free of charge. There's no downside to it, and it's helping your fellow man and woman considerably, without having to, lose your own organ as a living organism. So organ donation would be number one on my list to keep a program like the DREAM program going into the future.